pharmacies are concerned, we've put in a lot of new procedures into place. Our field teams are not currently going into the facilities out of concern for the safety for the residents and the staff there, just to limit exposure. So we're working through new procedures and accessing documents remotely that we may not have had to before. Our delivery procedures are different. We're trying to limit the amount of interaction that's necessary between the nurses receiving medications from the delivery team. Our processes inside the pharmacies are changed as far as the way we're entering the pharmacy. We're screening all of our employees to hopefully limit contagion from entering the pharmacies. As far as the facilities are concerned, they, of course, have a lot of new procedures as well. We're seeing a ton of droplet isolation that we weren't seeing prior to that. Of course, there were always procedures for isolation, but not to the extent that we're seeing. Some of our customers have had very limited or no infections in their facilities. We have other facilities that have a great deal. Their communications, they've got to have new processes for communicating with family members and healthcare team members. And with us, for example, not being inside the facilities, how do they communicate with us? What's the best method for us to communicate with them? There's been a ton of dining changes just to limit the amount of exposure between residents, the changes in therapy, changes in long-term care itself in the facilities is enormous.